Hi. My name is Liz Lane, and I've been a psycho-oncologist for the Illawarra Shoalhaven Health District for a number of years now, providing psychological support in both individual and group settings to adult cancer patients and the people who love and care for them. Studies examining the prevalence of mental disorders in cancer show that most cancer patients do not meet the diagnostic criteria for any specific mental disorder, and this was mentioned earlier this morning. However, many do experience a variety of difficult emotional responses, and these responses tend to exist on a continuum that sort of extend from those common feelings of vulnerability, sadness, isolation, and fear, to problems that can, of course, become increasingly disabling, and then may actually progress on to true depressions and anxiety and panic disorders. Since adjustment to cancer is not a unitary, single event, but rather a series of ongoing coping responses to the multiple tasks associated with living with cancer, and for some dying with cancer, we began to explore in our centre ways that we might equip our patients to better meet the ongoing challenges of the cancer trajectory. To address this need, we have now conducted a series of one-day workshops based on a model of self-compassion. To date, more than 60 patients have attended 3 workshops, and they have self-selected in response to flyers in the centre. We've also conducted workshops based on the same model for family members and carers. So in this paper today, which I will read because I do tend to get off track and we have very short time, so I'll stick to my notes. In this paper, I present the data related to the correlation between self-compassion and well-being in cancer patients at our centre, and then outline the content of our one-day workshops created and conducted to cultivate emotional balance. I present this as a pilot with the hope that in the near future we can actually evaluate the effectiveness of this self-compassion focused intervention in a randomly controlled clinical trial, should time and of course resources become available. So why self-compassion? There's been, as was mentioned earlier, considerable attention given in recent years to clinical interventions incorporating mindfulness strategies. But to date, most of those studies have considered mindfulness as the actual outcome measure, along with other outcomes, rather than as a quality developed during a wider practice. But the recent findings on the potential role of self-compassion as actually a mechanism of change in mindfulness-based interventions has prompted a number of psychologists, including myself, to further examine self-compassion. Self-compassion involves treating yourself with care and concern when considering personal inadequacies, mistakes, failures, and painful life situations. It's operationalized as having 3 interacting components: self-kindness versus self-judgment, a sense of common humanity versus isolation, and mindfulness versus over-identification. Self-kindness refers to the tendency to be caring and understanding with oneself, rather than being really harshly critical. Rather than attacking and berating oneself for personal shortcomings, the self instead is offered as acceptance. Common humanity in the context of self-compassion involves recognizing that humans are imperfect, that all people fail, make mistakes, and have serious life challenges. Self-compassion connects one's own flawed condition to the shared human condition, so that features of the self are considered from a broad, inclusive perspective. Mindfulness involves being aware of one's painful experiences in a balanced way that neither ignores or avoids or amplifies painful thoughts and emotions. It's necessary to be mindfully aware of personal suffering, to be able to extend compassion to oneself. At the same time, it's important to pay attention in a balanced way that prevents us getting really carried away by the dramatic storyline. Numerous studies to date have found that treating oneself compassionately when confronting personal suffering promotes mental health. It has consistently been associated with lower levels of depression, anxiety, and stress. In addition, a number of studies have found associations between self-compassion and positive psychological qualities such as happiness, optimism, wisdom, curiosity, and personal initiative. Given the emotional turmoil that follows a cancer diagnosis, we first conducted the study to explore the link between self-compassion and well-being in the participants from the Cancer Care Centre, to confirm that the literature on the general populations was actually generalizable to a cancer population, which had not previously been done. So we asked 60 patients to complete the following scales. The self-compassion scale was created by a fabulous researcher, Christine Neff. It's a really well-validated tool now, and participants assess the degree to which they agree or disagree with a number of statements. The 26 items assess the positive and negative aspects of the three components. That's common humanity versus isolation, self-kindness versus self-judgment, and mindfulness versus over-identification. We also asked them to complete the DAS-21 scale, which many of you will know and which we standardly use in clinic settings. The depression, anxiety, and stress subscales of the measure each contains 7 items. The depression scale assesses hopelessness, devaluation of life, lack of interest in life. The anxiety scale assesses autonomic arousal, skeletal muscle effects, situational anxiety, and subjective experiences of anxious affect. And the stress scale is quite sensitive to levels of chronic non-specific arousal. In addition, we measured individual subjective life satisfaction. The 5 items of the satisfaction with life scale measure global cognitive judgments of one's life rather than a positive or negative effect as such, and also participants' overall sense of being happy. And also the happiness scale. 2 of the 4 items on the happiness scale ask respondents to characterize themselves using both absolute ratings and ratings relative to peers, and 2 items offer brief descriptions of happy and unhappy individuals and ask respondents the extent to which each is a characterization that describes themselves. Looking briefly at the results, of the 60 participants, approximately 2/3 of the respondents' DAS-21 subscale scores fell within the normal range, which is to be expected, and as was mentioned this morning, not everybody is diagnosable as with anxiety or depression. They may not be disordered, but they're certainly suffering. 1/3 of respondents' scores were falling in the mid to severe and the extremely severe ranges. As can be seen from this table, higher total self-compassion scores were strongly negatively correlated with anxiety, depression, and stress scores. That is, lower levels of psychological distress and positively correlated with subjective satisfaction with life and happiness. Looking at the components that make up the positive aspects of self-compassion, both mindfulness and self-kindness scores were negatively correlated with depression, anxiety, and stress scores, and positively correlated with happiness and satisfaction with life scores. The finding for common humanity itself was not significant. However, the items in the self-compassion scale measure both the positive and the negative aspects of the construct. So here we find in this slide that while a sense of common humanity may not be associated with well-being, an absence of this, a sense of isolation, is associated with poor psychological well-being. Looking at the results of the 3 negative aspects proposed by the model, high scores for isolation, self-judgment, and over-identification are associated with high scores on all DAS-21 subscales and low scores on satisfaction with life and happiness scales. Having discovered that, yes, the findings in the general population were generalizable to our cancer population, we then decided to run some workshops. There's certainly evidence in the literature that we can teach people to be more compassionate towards themselves. So it is something that that there is a small but growing evidence base to. But my first intention was to actually find out how do people respond to a workshop or an intervention that actually looks at self-compassion. So 3 workshops have been run to date with more than 20 participants in each. To begin with, ground rules are established to encourage compassion for both self and others, reminding participants to hold each other in mutual respect, to take care of themselves and the others, to be curious, and importantly, to enjoy. The activities of the day focus on the 3 components of the framework for cultivating emotional balance. Beginning with an initial relaxation exercise, participants then reflect on and share their reasons for choosing to come to the workshop. They respond to the question, what brought you through the door today? The therapeutic intention here is to validate each individual's unique experience, while also drawing together the similarity in the themes expressed. A brief tour of the common emotional effects of a cancer diagnosis is then introduced to normalise participants' lived experience of these. After morning tea, we begin to practice mindfulness of the breath, allowing thoughts to enter the mind and pass like clouds in the sky, and we focus on the in and out of the breath. Self-compassion requires taking a balanced approach to our emotions, so that feelings are neither suppressed nor exaggerated. This balanced stance stems from a willingness to observe our thoughts and emotions with openness and clarity, holding them in mindful awareness. The mindful meditation exercise is followed by an explanation of mindfulness in relation to the recent neuroscience understandings, which is very optimistic and wonderful. Thank you. After lunch, the model of self-compassion is introduced. With mindfulness already considered, the participants engage in further exercises to engender common humanity. The intent is to recognize that suffering and personal inadequacy is part of the shared human experience, something that we all go through, rather than being something that happens just to me alone, which is a really common experience that patients express. The sharing experiences exercises of the morning had laid the groundwork, as had general unstructured sharing that took place over the lunch. For this common humanity exercise, a large pile of cards containing either words or images and symbols is scattered on the floor. Participants look at the cards and select 2 words or symbol cards that resonate with where they are right now and where they want to be in a couple of months' time. They then share their reasons for choosing their particular cards with the group, sharing their experience of living with cancer right now and their aspirations for the future. The third component, self-kindness, is then introduced. Discussion turns to how group members might increase their ability to treat themselves with kindness, being understanding towards themselves when they suffer, they fail, they feel inadequate, rather than ignoring their pain or pushing it away. We also look at and identify barriers to self-kindness, and there are many. In the final exercise, participants are asked to bring their awareness to other members of the group with whom they've shared their day. With eyes closed, they consider how each and every one of them has shared how they struggle at times, and how each and every one of them, just like themselves, wishes they could ease their difficulties. Holding the image of the other participants in their mind, they are asked to very quietly wish the group members well, to think as they visualize the participants that they have spent the day with. May you be safe, may you be peaceful, may you be kind to yourself, and may you accept yourself for who you are. This is often a really powerful exercise. We go one step further because recognizing that while each individual sends out wishes to everyone else in the room, of course everyone else has similarly been sending out those wishes to them. Everyone here is wishing you well. So after taking a moment to experience how it feels to have a whole group of people who actually know what it feels like to be experiencing some of the things that you are experiencing, to experience how that feels to have the group wish you well, participants are then asked to quietly think, may I be safe, may I be peaceful, may I be kind to myself, and may I accept myself as I truly am. This is the final activity of the day. Participant evaluations have been really favourable. Participants consistently report activities that encourage the sharing of stories and the recognition that others similarly struggle with aspects of living with cancer diagnosis are really helpful, that sense of common humanity. The acquisition of mindfulness skills and ways to bring more self-kindness into their lives through self-understanding rather than criticism is also regarded as highly valuable. And self-kindness. I love the last one, the May I Be Safe exercise. And this actually was from a gentleman. Yes, more women than men come to the workshops, but we do have a number of men. And this last one was from men. The May I Be Safe exercise was like a warm bath. I need to take more care of myself. So feedback suggests that our model is useful in providing a framework for psychological support of people living with cancer. It appears to have high face validity with participants, and many also report that even some months after the workshop, strategies learnt continue to be utilised with a beneficial effect. Given the psychological challenge faced by people diagnosed with cancer and the established relationship between self-compassion and well-being, future research will hopefully empirically evaluate the long-term effects of these groups. The reason groups are really cost-effective, and as we've talked, and because in the model is about common humanity, that is such a strong factor, you get that with groups. And people get to see that they are not crazy, it's just that the situation feels pretty crazy, and they get to share that. They also get to be able, as was mentioned earlier too, that they can actually sort of say it how it really is. So we run separate workshops for carers so that they can also say how it really is. In terms of funding it, I had a couple of years ago a small grant from the Cancer Council. I run them off-site. Each workshop costs about $500 for 20 plus participants. That includes the hire of a room, which we hire from the local radio doctors, fabulous room. I bring in lots of cushions and meditation things, and people can just relax, bring a blanket, learn some skills, learn relaxation skills, learn mindfulness skills, learn some strategies, actually feel connected to other people. And a number of people too afterwards, they'll often, because we have a lunch and we put on some nice food, then they start chatting and they share telephone numbers. So they actually carry on supporting. So in many ways, my work as a psychologist is sort of done. Having said that, given the reveal, they've come and they've seen me, they know who I am. We've just talked about everyday stuff. So that if down the track they do need, they already know who I am, they know how to contact me, and we've kind of got over the stigma. So yeah, I hope that some funding might become available to actually start actually really, checking out the evidence, whether we can teach this self-compassion and how effective it is, because I think it's a really nice model. Thank you.
Thank you. Thank you, Liz. We do have time for one question. Does anyone have a question for Liz on the program? No?
Oh, good. Thank you.
Otherwise, you can go and grab her at lunchtime, I'm sure.
Yes, I'm available at lunchtime. Yes.
Yes, one.
Do you have to be part of the Illawarra Cancer Centre to access that workshop, or could you attend from out of area, basically?
Well, the situation is a bit difficult because I've actually just last Friday finished my role in that.
Oh, really?
But I'm sure that they will continue, and I hope that I will be able to continue doing those in some capacity. I'd love to carry on running them. Yeah. I'd love to evaluate them. But our criteria at the Cancer Care Centre at Wollongong Hospital is either you don't have to be being treated there, live in the area or whatever, and a number of patients are treated in the private sector and so on, and that we're fairly open to that for the workshops. Okay. So it's a watch this space ongoing project, I hope. Thank you.
That's great. Thank you very much. Do we have any more questions, or we'll finish off because we're trying to make up a bit of time. So please, thank you, Dr. Lisbeth. Thank you. Thank you.